3 women, the same horror story. Surviving the unbearable and inhumane conditions at Dora Nginza Hospital. 4 years ago, Noluxolo Ndlazilwana gave birth to her son there. A day later, she was discharged with no medical assessment or proper cleaning of her womb. Days later, she returned in pain, unable to walk, talk, or do anything. Nobody even wanted to attend to her as she lay waiting for treatment for weeks. She even developed bed sores, and still nobody came to help. And then the unthinkable happened. The hospital removed her uterus without her consent.
The question that I asked them after they told me that they had removed my womb, I asked them with whose permission, because I was not in a state where I could sign anything. Also, I was not even able to speak that time. But my aunt did leave her contact details and asked that if there is any urgent matter that needs family, she could be contacted immediately. But the hospital said because they saw the state I was in, they decided it was best to remove my womb. And I said, but do you see the damage you have done now? Are you aware that your negligence means that I will never be able to have a child again?
Dora Nginza Hospital, situated in the heart of Zwide Township, looks like any other public hospital. A Facebook posting asking for people to come forward with their stories brought about a flood of responses. An anonymous source inside the maternity ward currently gave us a glimpse of the conditions.
Toilets nazo siyazicleanela ngokwethu. The shower esinayo A1 for patients ezi-24.
I was told by the clinic that my due date is on the 12th of November. But when I came for a checkup at the doctor at Dora, he said my proper due date is on the 2nd of November. When I arrived at Dora on the 2nd, I was told that I would have to wait because there's only one theatre and they are going to prioritize high-risk patients. The doctor told me that there's nothing he can do because they just don't have enough space to accommodate us. There are people who have been here for weeks, others months, and still have not delivered their babies. I have been here for almost 3 weeks now, and I'm 40 weeks pregnant. There is still no sign that I will ever deliver my baby.
Noxolo Swartboy became a first-time mother at the age of 20, but the experience haunts her to this day.
The one lady who was concerned, I think she was a sister in charge or a matron, I'm not sure. She said to me, "Mama, let me check you out. Let me see what's going on with you." And as she checked me out, she saw, but no man, this doesn't look right. She took me to a OBGYN, a doctor, and then he said, "No man, this is not okay. We have to book her in for an operation to clean this out and to redo it." They called it stitches, I think. And then I was like, okay, fine, you know. And then I waited because they said the next day at 8 o'clock I must be sitting there waiting for the doctor. I wait. Now you must remember at 9 you must still go and breastfeed your child. So I walk all the way to the prem unit to breastfeed, and then I come back. They're like, "Hi, wethu, umphosela ugqirha, so ke andiyazi into yakho." I'm like, how? Njani? You know, okay, is there going to be another time where I can see this doctor? No, none of that. I was like, hi, boom. So they gave me those papers on the 13th of June. I must go get the stitches taken out. I get to the clinic. They're like, "Oh man, this should have been taken care of at Dora. Why they discharge you unjena?" And I'm like, I don't know. I told them of the pain. I showed it to them. But I can go. And they're like, no, straight to Livingston.
If you leave with your baby, it's a miracle. If you leave alive, it's a miracle. It's not like if you go to another hospital where it's an everyday thing that people leave with their babies and people leave alive. There, if you get to leave with you and your baby alive, it's a miracle. Because they can't help you.
Another patient is just grateful to have survived the experience. She waited nearly 3 weeks to give birth, only for her child to be hospitalized with pneumonia for 3 weeks.
So while you're at Dora, when you first arrive, you are moved to a ward, but when you get to the ward, there's no beds. There's recliners, black leather chairs that we are only allowed to sit on during the day. Then in the evening, we have to sleep on the floor. concrete floors. You are 9 months, 10 months pregnant. That I cannot even begin to explain that agony. I was on that floor for almost 2 weeks. So that definitely had an impact on my daughter. So she was in PICU at Dora for almost 2 weeks, I think, but she was in hospital a total of 3 weeks.
The portfolio found Dora Nginza Hospital a mess. The members are unhappy with all service delivery units and the general state of the hospital.
So we've given some instructions that we want to get reports from the CEOs on the recommendations of the Public Protector, the SIU, and also the Health Ombud, and also the recommendations, our own recommendations. Within 3 months, we're going to have a follow-up meeting with the CEOs of the hospitals, the provincial leadership, and also the executive of the executive leadership of the Eastern Cape.
The Provincial Health Department says it is taking the suggestions from the Portfolio Committee to heart as it moves to change the situation.
A task team of the Metro and provincial management teams has been established to develop and implement a turnaround plan for Dora Nginza Hospital. This team has been hard at work these past 3 to 4 weeks, implementing short-term actions like filling of critical posts and procuring critical equipment and acute maintenance issues. The biggest chunk of the budget for Dora Nginza Hospital goes towards NHLS, patient foods and medical consumables.
The Eastern Cape Health Department is also saddled with medico-legal claims of more than 4 billion rand just for this financial year. The department says the high costs are due to claims filed by unscrupulous legal practitioners colluding with healthcare professionals. But in the 2020-2021 financial year, writs of execution arising from successful medico-legal claims amounted to almost 1 billion rand. Lerato Fekisi, SABC News, Gqeberha.